gum recession. There's no more fingers of tissue that come down between his front teeth, so it just looks like one solid ridge. That is a deformed tooth. These teeth have shifted over time. And then the lowers are very, very shallowly rooted, like you can see most of the root. So this tooth had been pulled forward towards us, and it's best to take it out so it didn't get caught on anything. But I'm quite certain that he has a disease called EOTRH, which is advanced periodontal disease of older horses. There's his incisor.
So you see that only in older horses?
Typically, I think it's been reported in the literature as young as 6, but it's typically something in middle teenagers to 20 years old.
And what causes it?
They don't know. They think it's either genetic or autoimmune or environmental. They don't know, but it's a real thing.
There's a reason this horse was violent about having his mouth touched when he came in last year.
It's very painful. They have reported this disease in cats and also in humans. It's a resorptive disease of cat teeth, and they become very, very painful, and they are salivating excessively, and they take them to the vet, and they take out all their teeth, and right after surgery they'll eat.
What does reabsorptive mean?
It means that the tooth material is being eaten away by the body in an autoimmune reaction.
Wow.
So it's super painful, and people can get it, so they report also that it's very painful. So I'm sure that this is what this horse has been going through for many, many years, and it's part of his head shyness. But we do not ever, and pretty definitively say ever, see an old horse lose his front teeth with old age. They might lose all of their molars at some point, but they will never just lose their front teeth with old age. So if you see problems with the incisors, crooked, overcrowding, lots of tartar, the gum tissue worn away, the teeth falling out.
Can you hold that up so we can see the shape of it? It's normal place. It's normal way. So.
Sometimes clients call me and they say my horse got kicked in the face and he's lost a couple incisors, which can happen, but if it's an older horse and they lose their incisors, it's typically this disease.
And the name of the disease again is?
EOTRH. It's Equine, Odontoclastic, Tooth Resorption, and Hypercememtosis. So the body is having a major immune response to something, and it's some cells are laying down more tissue and some cells are being eaten away, so it looks like the end of the tooth looks like it's moth-eaten. They're very light and porous, and they don't stay very firmly rooted in the mouth, which is why I could pretty simply just remove it without any struggle. And you can see some extra tooth material has been laid down here. This is one of the cells, is the body is telling some of the cells to lay down extra material to more firmly root the tooth in the into the gum, but it can't because it's a diseased tooth. So they fall out.
And this is Frankie, who came in last year, January 2018, emaciated, and he's a very easy keeper. He gets 1 quart of senior twice a day in grass, and he's a very easy keeper. Thank you, Dr. Bess.
No problem.